Kisiizi is very grateful to Kisiizi partners for the vision and all the support that allowed the construction of the Mothers Waiting Home that has had a fantastic impact on many, many families in our region, as you will see. We're going to show you some video clips made here, including an international TV channel documentary. We're grateful too for the research and protocols put together by Dr. Helen Smith and for all the encouragement we've had from Kisiizi partners for this project.
In 2012, there was a terrible tragedy when on two separate occasions women arrived in maternity in the labour ward already dead. How terrible that in this era where such fantastic advances have been made into the world of medicine, people arrive without having easy access to medical care. It has proved very popular with over 400 admissions a year and an average length of stay of 13 days. And we believe it has made a very valuable contribution to women having universal access to health care.
Let me tell you that one of the biggest problems in the rural setting that we are is access to health care. And this is made hard by the very bad road network. Now bringing a mother who has a very undetermined and unsure access to hospital if need be. If you bring them close to the hospital, then it eliminates that burden. So it has made a very tremendous outcome, a very tremendous change to patient care in our region.
So in the waiting home, we do a lot of health education. You see, this one we are educating mothers on what to feed on. There we are educating mothers on what to prepare before they come for delivery. At least some of these things, they could prepare them. And here we tell them how to always go for antenatal. Even when they are in the waiting home, they can still do their antenatal services around here in the antenatal clinic, Kisiizi Hospital. So here we encourage them to sleep under the mosquito nets to prevent malaria in pregnancy, which is very dangerous. And so you're welcome inside. Okay, so these are the different cubicles. There are mothers who stay in here. It is just around 4:30 now, and most of them are outside they are not inside the rooms. So this one is showing mothers to not smoke. You're from far, you just come here. We accommodate you because it is almost free being here. Even if you spend here how many months, it is still okay. And they are doing well here. If they get any problem, we just tell them, just report to maternity immediately, as we've always done, and the outcomes have always been good. Okay, so this lady has just been with us for about 3 weeks. She came in with weight and abortion, and she's still from very far in Dubai, so she had to come here. We managed her when she stabilized on maternity. We brought her down on the waiting home so that the bills do not increase much, and the distance from home to here, if she gets a problem, is far. So she had to stay here for that time. So she has been here for about 3 weeks, and she's now doing well.
I can think of many that have come through this particular place. We had a mother who came in with threatened abortion, and it turned out that her placenta was not lying. That had happened at around 23 weeks, and she was with us for 6 or 7 more weeks, and at around 30 weeks she got an acute gush of blood, and we were called in, we intervened in timely, we did a cesarean section and removed a premature baby. And the baby is improving right now in special care. Had this mother been home, the outcome would have been different for both the mother. The bleeding was so acute and so rapid that she would have lost her life had she spent a few minutes before coming.
The baby is now off oxygen.
Mothers who have a lot of liquor inside their abdomen, what we call polyhydramnios, are at a high risk, and so we keep them here for closer monitoring. There is a particular patient I remember who had in her previous pregnancies lost pregnancies for unexplained reasons. She had carried 4 and she had no living child.
Okay.
And so we saw her in the pregnancy early enough at 8 weeks, and we did some investigations, and she actually requested to stay in hospital, partly because of social problems. She was being ridiculed in her home village, and so she thought she could not take in another 7 or so months of stress. So she kept around from 2 months up to 9 months.
Wow.
I'm happy to report she went back home with a baby. So it ranges between as long as 6-7 months to up to a few days.
And you've just described a scenario where not just physical risk, but actually mental risk in terms of stigma and so on. So that helped her enormously, I think.
Yes.
Tremendous.
There is a worker, a helper, or we call a hostel matron, who keeps watch over these ladies every night. And she has access to the main ward. She's always in constant communication with the nurses and the staff on the main ward to report any eventualities, but also to help the mothers during the night. Always 3/4 full to full. When they are here, we encourage them to do daily activities of living, washing for themselves, cooking for themselves, moving around. However, it has helped in a way that it reduces the much stress and burden they would have had if they were at home, taking care of all their children and mothers-in-law and digging from morning to evening. So that much stress is cut off, and it is helpful for the mother. There is a daily ward round, and during the ward rounds we give health education to each individual patient, individualized education. And we've provided a television set, and we want health education programs to keep playing during the normal days of these patients.
The cost of healthcare can be a matter of a life and death in some parts of the continent. But a hospital in Western Uganda is trying to ease the burden that pregnant women face during childbirth or from complications during pregnancy. It's running a low-cost mothers waiting home where soon-to-be mothers can welcome their babies safely. Darren Allen Tachine reports from Uganda.
In about 2 weeks, Peace Chokutamba will welcome twins. She is a mother of 4 and lives 15 kilometers away from the hospital. But for the last 17 days, this has been her home.
I chose a C-section when I reached 8 months because I felt heavier and had pains. I'm expecting twins and it's overwhelming, so I came to the hospital to get help. I've had a lot of assistance. The babies are fine, and I'm also fine.
This mother's non-profit waiting home at Kisiizi Hospital is a game changer for prenatal care in this area. It is a hilly place, and reaching the hospital in time is a challenge for many pregnant women. But once they arrive, this 24-bed unit accommodates expectant mothers who lack other medical support.
We usually have mothers who are high risks, so they have to be in hospital. For example, they have previous cesarean section scars. They have their past obstetric history is not good. Maybe she has carried like 9 pregnancies but no live child. We have incidences like there are these mothers who usually bleed before delivering, so they have to be near the hospital.
This place is a haven for many mothers and their babies. During their stay, a pregnant woman is seen daily by a midwife and checked by a specialist once a week, all for a relatively low monthly cost of $2.83. Uganda's Bureau of Statistics say about 336 of 100,000 women die while giving birth each year. This Mothers Waiting Home has helped more than 2,000 mothers in the past 7 years, and its impact has been greater in the aftermath of the coronavirus pandemic, when many people stayed away from hospitals.
To our surprise, even when other hospital patients reduced in number, mothers in the mother waiting home increased in number. Why? Because of the transport restrictions, they thought it safe to be in the hospital all the time. But also, they didn't have fears about transmission, because they have this feeling that it's outside the hospital, and so they are not exactly patients, and they don't overly interact with the rest of the patients.
The facility is now so popular, it is often overflowing.